I'm Dr. William Padula, and I'm a neurooptometrist in practice at the Padula Institute of Vision Rehabilitation in Guilford, Connecticut. My practice is unusual in that it is limited to patients who have neurovisual processing dysfunction and binocular vision problems caused by a neurological event or condition such as traumatic brain injury, stroke, multiple sclerosis, or other occurrences. What I was looking for in an OCT was an instrument that would enable me to assess and differentiate neurovisual processing in the brain from problems located in neurofibrillary tract from the back of the eye to the brain. I found that the RS-3000 was clearly ahead of other instruments in its ability to do that. Plus, it met all my criteria for macular and glaucoma assessment and made it easy for me to show pathology to the patient. Add to that its high resolution and exceptional stereo imaging and 3D capabilities, the RS-3000 was an obvious first choice. The high-resolution OCT and the built-in analysis capabilities of the RS-3000, along with its ability to combine those with fundus photography, made the device instantly useful. The instrument's ease and speed of use are critically important for my patients, who fatigue quickly. Some of my patients are challenged just to remain upright, so the brief exam made possible by the RS-3000's ergonomics and rapid processing speed really counts. The RS-3000 not only met but exceeded my expectations. I expected a user and patient-friendly device that produced high-quality data, but I didn't expect the ease with which the RS-3000 has integrated with my EMR. Although I have a very popular EMR system, integrating various other diagnostic devices with it has been cumbersome and frustrating. In the case of the RS-3000, however, the integration was seamless. The integration worked so well that I subsequently converted the rest of my diagnostic technology to NIDEK instruments. And now all of it integrates beautifully. My primary use of the RS-3000 is to differentiate afferent neural impairment from neurovisual processing dysfunction. While this is not the way most optometrists and ophthalmologists would use it, many of the features that make the device valuable to me will be important to doctors who use it in a more typical fashion. It's critical for me to be able to distinguish problems like glaucoma and macular degeneration from problems rooted more deeply in the central nervous system. But any doctor for whom glaucoma and AMD diagnosis and progression are important should find the RS-3000's retinal and optic nerve evaluation capabilities immensely helpful and easy to use. NIDEK came in and introduced us to the instrument, and my staff was off and running with it the next day. We haven't had any problems. And NIDEK has provided the best technical support I have experienced in my entire time in practice. The quality is just superb, and I've had no unscheduled downtime with any NIDEK instrument. The rock-solid reliability of the technology, including an absence of software hassles, is part of what makes me satisfied with its acquisition. Here's a case in which the RS-3000 showed its value. An adult male, 56 years old, was referred to me with a history of concussion from a motor vehicle accident in which he had suffered a brief loss of consciousness. Despite regaining consciousness quickly, he had a number of symptoms that persisted longer than expected. One oddity was that although presbyopia was his only visual complaint prior to the accident, 4 months after his injury, his visual acuity began to decline, and his peripheral vision was showing signs of deterioration. Using electrodiagnostic instruments, I was able to diagnose a spatial visual processing problem called post-trauma vision syndrome. However, that did not account for his loss of acuity. Data from the RS-3000 told that story. Not only did his accident cause a central spatial visual processing dysfunction, it also caused a traumatic glaucoma. The patient's other doctor hadn't been able to pick this up. but the high resolution of the RS-3000 made that glaucomatous optic nerve damage apparent. I highly recommend the RS-3000, but I'd go beyond that. I recommend considering additional NIDEK ophthalmic instruments. I find that having the full suite of instruments gives me an integrated network of state-of-the-art diagnostic devices that are user-friendly and work together reliably day after day. In addition, EMR integration is seamless, and the technical support is the best I've seen. Knowing that I have the best technology and that I can rely on it gives me confidence and helps me focus on what is important, which for me are the challenges of neurooptometry and patient-centered care.